We have a miracle kitten on the loose. Whoops. And my dry button is leaving. What are you doing down there, miracle kitten? Where are you going? You're not supposed to be in here either. Oh. I know. You're not supposed to be in here. Why are you so obsessed with going that way? There you go. Where are you going? You can move pretty fast on this floor, can't you? Look, I brought you here to do your physical therapy. Look. Oh, he's very mad. He's very mad. Oh, come on. I know. Look. Look what I have for you. Yeah, there you go. Now, where are you going? Impromptu miracle kitten field trip. So where are you going? You know what we need to do. You know what we came here to do, buddy. He looks like a little monkey in his little therapy jacket. Because it makes him look very skinny in certain areas and then less skinny in other areas. Oh, he's so mad. Mad. I thought maybe he would behave if I brought him over here and put him on the camera. I thought maybe he would behave and we could do some stretching. He has had a growth spurt. He's enormous. He weighs 6.2 pounds. He's very mad. This is what it's like when we do physical therapy. It's not because he's in pain. It's because he's stubborn and he doesn't want to do stretching right now. Here, wait, what about this? Look. Oh! long his tail is, though. That's the kitten's tail. Where are you going? What about this? Casserole, that's a good one. So on the 21st, we are going for Botox. Botox in his quadriceps. Where are you going? Excuse me. He just scoots away when he feels like it. Because he's getting more and more difficult with his stretching. And with his growth spurt, he seems to have, his muscles seem to have grown, so it's even harder. So I feel like we're sort of fighting a losing battle with just the stretching. This floor is nice and slippery for you though, huh? So I'm hoping that the Botox will help somewhat, but it may do nothing, but it may help. Oh, now he's gonna get stuck in the cords. Hey. So, Botox is used for kids with contractures. There's at least one documented case of it being used in a cat with somewhat of a benefit, but not like a major benefit. So don't get your hopes up too much, but it's kind of our last resort. So we're hoping that it will make a difference. Right, buddy? This is gonna be busy. Maybe he likes to look out the window. Look out the window. The problem is you don't have anything to... Oh, nope. It's busy. He's got places to go. So, we're hoping, because the stretching alone is getting less and less. Like, we've hit a point where I can't get him any more flexed than like 105 on the right and 135 on the left. And a normal cat leg should flex to about 20 or 30 degrees, so we're still off by quite a bit. So, oh, he's so mad. He's so mad. What if we just have some snuggles? What if we just do snuggles? He's too much exciting stuff here. Too much. Kestrel is downstairs, so they have not met. Okay, I'm gonna put your thumbs down, but I don't want you to bang the ends of them. Okay, here we go. He's so busy. We'll just follow him. adventure. That was just the purplish growl. Where to, buddy? That's the computer area. You can't go in there. That's where some of your friends are in there. There's a cord mess I haven't cleaned up. And the bathroom. That's not for you. That's anti-kestrels. Here, keep going this way. Oops. This is the room he used to hang out in. You've been here before. You cannot fit under there anymore. Oh my gosh. Now there's no way to get out. Oh my gosh. How did you do that? Here he comes. Oh buddy. That's gonna be a challenge for you. Yeah, come out the way you went in. Wait, this room, we can just hang out here for a while. This room might fun. Hey, remember when you used to play with this thing? You used to really like this guy. Remember that? He has spent time in this room before. Here's some of your stuff. You remember this? Remember this bed? Oh, you're so busy. You're so busy. Come on. Come on. Oh. Like, do you remember this? Oh, yeah, sometimes he takes his bed with him. Oh. Okay, I'm coming. There you go, buddy. Good job. Yeah. Look, how about some ribbons? Maybe, I know, it can maybe keep you distracted. Are you my big boy? Are you my big boy? Come on. Oh, so bad. Okay. Oh, keep it nice. Come on. Oh my. Look. Look, I got something that you're gonna like. Okay. Oops, oops. I just saw something exciting. He's a handful. There's a string hanging down that keeps distracting him. What are you doing with your thumb? Oh, we got him. Did you just tip over? Back on your tail, buddy. I bet he smells food. That's where Kestrel kept her food. So it probably smells like food, maybe. Oh, you smell something there? Anti-kestrel? Oh, your hex bug's going with you. Do you want to take off your vest? Or maybe we'll try stretching. Should we try stretching for 1 second? And then maybe we'll let you explore. He says, no. Oh no. He says we were doing just fine without the stretching. Oh gosh. Oh gosh. Oh, what a good boy. Oh, he's such a good boy sometimes. Sometimes he's a good boy. Look, I'm stretching him. Oh, he's not into it. He's a big boy now. I can't just hold him and stretch him. He's grown accustomed to a certain lifestyle that does not include stretching. Well, it does for another month. Oh, he's so mad. Oh, buddy. Alright, here, let's try this. We'll take a little break. We'll take a little break. Oh, okay, go. Oh, it's free. But wait. So the goal of the physical therapy is to restore function to his knees, which are locked in hyperextension. Because we want to do some osseointegrated implants into his tibias, which is below the knee, and that would essentially restore the missing part of his leg, and he would be able to walk normally on 4 legs. So unfortunately though, he has not shown any interest in flexing his legs, flexing his knees voluntarily. Right, buddy? Oh, it's gonna get you. So I've been doing hours of physical therapy every day since September, trying to increase range of motion and get him to flex voluntarily, but so far no dice. Well, I have increased range of motion, but not enough. And he still has not voluntarily flexed anything. His injury was complicated because he has a great deal of is he getting me? He has a great deal of skin mobility, which means that his skin is loose and not attached to the muscle or bone, which means that it's really difficult to attach anything like a splint or a garment. It's just not possible to keep anything attached unless I really tape it on there, and then that of course pulls out his fur and gives him sores and things like that if I do it on a daily basis. So it's been a challenge, and of course he is less and less tolerant as he gets bigger. So and his pups. So anyway, hoping that the Botox will relax his quadriceps because they're very, very strong and very tight. And that's how he raises his stumps up to clear obstacles. Ooh, the hex bug is getting frisky over here. Where did it go? Oh, wow. Oh, it's got like a bonus. It's got some bonus fluff. Picked up some fluff along the way. What do you smell back there? What do you smell? Search, and so have come up with the dose that makes the most sense, and then we're going to go to a neurologist on the 21st, and they're going to do EMG to identify his motor points and possibly another CT scan to see if there's any fibrosis in there. Oh my gosh, you're so full of so much fun. So much fun. Get your X-Bug. What about this? Oh, you're sitting on something. Oh, get it. He's a delight when we're not doing physical therapy, I should point out. But he hates it. So, I'm hoping that maybe there is an end in sight to at least the physical therapy. If the Botox doesn't work, then we're going to have to move on to plan B, which is either leave him as is and deal with whatever complications arise when they arise, which is not a super great option, or we start looking into implants into his femur, which is his thigh bone, which is what Vincent the cat in Iowa had done. His injury was the most similar I've seen to Cassidy's, and he also had his knees became locked in hyperextension like Cassidy's. So I don't think they tried any physical therapy to reverse that, but he has been. Uh-oh, you got it hooked on you. Go on. His stumps are always getting hooked on things. Come on. Come back. Come back. Come back. Come here. So anyway, I was saying, so plan B is like Vincent. You can Google Vincent the cat, and you'll see, which obviously it's less ideal of a solution to go into the thigh, because then he doesn't have knees anymore. So that's why I've been working so hard for the last September, October, November, December, February. Wait. November. Because it's been almost 7 months that I've been doing physical therapy every day for hours and hours. How many hours is it? It's a lot of hours. Worth it, but we'll be sad if it doesn't work ultimately. But yeah, so ideally, the most natural solution for him is going to be if his knees would ever work, but there's not a lot of progress at this point after 7 months of trying really hard. So, where are you going? Where are you going? Oh, I got him. Oh, he's growly. So growly. Oh, he's very growly. Here's some catnip. Smell this. It smells like catnip. It makes you happy. So, so I don't know what will happen if plan A doesn't work. Wheelchair is no longer an option for him. He hates being restrained, and so he hates being strapped into it. And he actually gets around more efficiently just like this. And he's able to climb very well. And he can't do any of that if he's strapped into a device. And so the downside with leaving him just like this is that he'll probably have pain in his knees as he gets older and bigger. His hips have started sort of popping, and we did see on the CT scan in North Carolina that his hips have been subluxating, which is not great, and probably a byproduct of the way he scoots. So that will only continue to get worse. His back, you can see just the way he moves is very abnormal for a cat. He should be up like this. And so, you think that after months and years of moving like that, probably puts a lot of strain on his spine. He drags his man bits on the floor, and so there's a risk that stuff will get in there and cause infection. He's gotten some sores on his stump from dragging them. So there are lots of potential complications just leaving him as is that would degrade his quality of life in the long term. Come here, come here. Oh my gosh, you're so fast, you're so fast. Whoa. Buddy. What happened? Did you hit yourself? Yeah. Well, I know. I'm sorry that you hit yourself. Oh. He's mad. He was scooting downstairs at a high rate of speed, and his little stump tip smacked on the stairs, and his little stump tips are quite sore. So he's extra mad. Now he's extra mad. Here, take it out on this. Take it out on this. So anyway, leaving him as is, not my favorite solution. But in the short term, he's doing okay. He's doing okay like this, but long term, I think we'll have lots of problems. So, and then implanting into his femurs is kind of the other option, and so that gives him kind of a different gait, but it potentially allows him to walk on 4 legs, which is better. He could have kind of a normal movement minus his knees, of course, so it's not ideal, but it's probably better than the way he moves now. But that's a decision that's going to be very, very difficult to make, and so I'm hoping I don't have to make that decision, but we'll see. But regardless of what happens, he's very happy, and well, not that you would know that from right now, but he is actually very happy and content, and He is enjoying being alive, even though you would never guess that from his behavior at the moment. What did you find over there? So anyway, he keeps us busy, keeps us on our toes. Uh-oh, oops. No, I've done it. And as you can see, I'm not getting any stretching done. So I'm probably going to take him back across the street and actually try to get some real stretching done, because we've gotten nothing done since I brought him over here. Yep, I have seen the drag bag. The problem with that is, of course, I can't predict when he's going to have to go to the bathroom. And he does get around okay scooting. There is some friction. Where are you going? You can tell because he's got like little worn spots on his thumbs where all the hair has worn off because he scoots on them. But I've probably seen every possible thing out there. I've probably tried most of them. Hi. Oh, you're so handsome. You're so handsome when you're mad. What's out there? There's so much to explore. Yes, that is a giant Lego wall. It's pretty awesome. It's the same thing that made the ledge wider in this room. Well, where are you going? Oh, he's got to go. He is busy. All right, I'm gonna pack him up. Look how cute he is. Look how cute he is. So cute. I'm gonna pack him up and do some real stretching. Is he at full size? He's definitely small. And we were thinking that by 7 or 8 months, usually they're done growing for the most part, and so that's when we had been talking about the earliest possible time of doing surgery, but he's older than that. Well, he's what, 8 months? Yeah, about 8 months. And so, and he's only 6 pounds, so although he did just have a growth spurt, but I don't know if he's just behind and still has catching up to do from his. No, don't do that again. Don't do that again. Remember, you hurt yourself last time you did that. Oh, what a good boy. Sometimes he's a good boy. Sometimes, isn't he? A good boy sometimes. All right. Should we take you home? Should we put this back on before we go? So he was way underweight when he came in, so he may have his growth stunted from that. I don't know if he'll catch up or if he'll be small. He loves his garment. Loves it. Oh, he's being such a good boy now. The camera came off the tripod, so I can't really control it. The little screwy thing broke off. This is a new camera too. But now I can't point it. Oh, you're so adorable. Maybe I'll put him on when he's not quite so grumpy. I never give up on any of them. I mean, I've been doing physical therapy for 7 months now. 7 months every day for hours and hours a day. So, and with like no progress. So that hasn't made me give up. It's probably because there's something wrong with me. Sorry, it's hard to control the camera when it's not on a tripod. There, now you can see. Oh, now he's being a good boy. Where are you going? Alright, now we have to go actually do some stretching. Ooh, oh, did he just lay down? Are you gonna be a good boy? Are you gonna be a good boy? No. Look at just, oh, he's being a good boy now. He's giving kisses. He's giving kisses. He's a good boy. Yes, he's been neutered. What's up? What's up? Remember when I first got him and I couldn't get his whites? His whites were brown. He was dirty. He's so dirty. He had brown whites. Fairy's cleft lips is fairly mild. And her palate and her nose, everything's fine. It's just her upper lip that's a bit cleft. Alright. We'll review this. Casserole. Wait. Casserole or bunny? Oh no. Or cat. Are you a casserole? Oh, with kisses? That's nice. Okay, alright. Switching back over. Switching back over. This is what he looks like when he looks at me. Are you a good boy? Oh, he's such a good boy. He's such a good boy. Do you want to give me kisses? Oh, what's that? skateboarders. Oh my goodness. Alright. Back to kittens, everybody.